Hi, I'm Dr. Julie Marmon with ER Specialist Urgency Center. Let's talk a little bit about chest pain today. Chest pain is sort of this big, bad, scary topic. It freaks people out, especially as they start to get older. We all envision that this is the big one, we're having the heart attack. But there are a ton of things that cause chest pain. Let's talk about the bad ones real quick. We're not going to linger on them. And then we're going to talk about some other things and when you should get care. So the big bad things, as an emergency medicine board certified doctor, I worry about, of course, a heart attack. We call that a myocardial infarction because it means part of your heart muscle could be dying. We also worry about something called unstable angina. That's when your heart is right teetering on the edge of wanting to get a blocked artery. And when you put your body under a load by working out, by walking, by increasing your stress level, that can give you that chest pain feeling that's a harbinger for bigger, badder things. And we're trained to look for that. We also think about something called a pneumothorax. That means your part of your lung has collapsed. Because remember, chest pain doesn't always equal heart pain. It also can be lung pain. We think about a thoracic aortic dissection. Big phrase, kind of a scary thing for a lot of people, for most people. And that's a bad problem. That can cause some pretty severe chest pain. We also think about pneumonia. Pneumonia isn't quite as severe as some of the other problems, but it's certainly something that can cause chest pain. We also think about pulmonary embolism. That seems to be a big word that people think about these days. That's a blood clot, typically starts in your legs, that can travel to your lungs, lodge in your lungs, in the blood vessels in your lungs, and that can cause life-threatening illnesses or even death. All of those first few things are things that, as an emergency doctor, that's what I'm looking for. When you walk in my office, I'm asking questions to make sure that you don't have one of these problems that needs immediate attention. So what are the other things that cause chest pain? There are 100 different things, and probably more than that, that can cause chest pain that still hurts horribly, but on the scale of emergencies is a more minor problem. We think about something as simple as reflux. So you get a little heartburn, you get what we call esophagitis, you get some erosions in your esophagus. That can cause severe, what we describe as substernal, meaning right in the middle of your chest, pain and aching. It can come on pretty suddenly. It can be associated with some of the same symptoms that heart attacks are associated with. So it's something to think about. We also look for something called a costochondritis. When you run your hands along the sides of your ribs, right at the front of your chest, that is where the ribs come into that breastbone, or the sternum as we call it. There's a little tiny piece of cartilage that allows just a little movement between the ribs and the sternum, and that can become inflamed, just like any joint or any place you can get arthritis. That can cause really significant pain as well. What else can cause chest pain? Esophageal spasm. You can get chest pain from muscle spasm, or from working out too much, or from pain in your back that is radiating to your chest. There are plenty of problems in the abdomen that can radiate up into your chest and cause chest pain as well. So what do you do about it? When do you come to be seen by your doctor, or when do you go to the emergency room or to ER Specialist Urgency Center? Anytime your pain is so severe you can't control it at home, that warrants an evaluation. When your pain comes on with exertion, meaning you walk across the parking lot and you reach for your chest because it's so uncomfortable, that should prompt you to be seen pretty quick. If your chest pain is associated with shortness of breath, with fevers, or when you take a deep breath you have pain, those are all reasons that you should be seen fairly quickly. However, if at any time you have questions, many insurance companies have nurse triage lines. You can call your primary doctor, or you can give us a call if you think you need to be seen. And certainly if you have chest pain and shortness of breath, or any other concern for severe life-threatening emergency, call 911. Don't call us and ask questions first. We're always happy to see you, but we want to make sure that your health comes first.